Hello and welcome to the video of the big heart. Personally, one of my favorite models because who doesn't love a giant heart? Alright, so let's get started on some primary structures we can see from the anterior closed view. So the very first one is that we can actually see these left and right auricles. They are like leaflets on the left and right atrium. We can also see some of our large vessels, such as the pulmonary trunk and pulmonary arteries, our aorta, and our superior vena cava. But what we're most interested in is that coronary circulation. So off of the aorta, you actually have these two large coronary arteries that come off. One will be the right coronary artery, and the other will be a left coronary artery, which we can see up here. So that right coronary artery will come down and it'll branch into the marginal artery, and it'll continue on the posterior side, which we'll visit in the next video. The left coronary artery will branch into the anterior interventricular artery and also into the circumflex artery, which flexes around the heart to the posterior side. One thing you should know is that this anterior interventricular artery lies within the sulcus of fat called the anterior interventricular sulcus. And there's also a coronary sulcus, which we can see right here. It's where the major coronary vessels lie, and we'll get to see it again on the posterior side. Other vessels of interest here is our great cardiac vein. So our great cardiac vein is paired with our anterior interventricular artery. All right, welcome back to the big heart. So this is the anterior view, but we're interested in the posterior. So we're going to follow that right coronary artery around. It's going to come on this posterior side to form the posterior interventricular artery. That artery will be paired with the middle cardiac vein, and both of those will lay within the posterior interventricular sulcus. And then on the other side, we come from our circumflex artery, just to give you some orientation. And we actually see what's called this coronary sinus. And it's a large vein that gathers all the deoxygenated blood from the heart and will drain directly into the right atrium. So this is a view of the big heart from the top looking down. So we're looking at the base. And what we can see here is we have that pulmonary trunk, which will give us our pulmonary arteries. We have that aorta, which will give rise to some very important vessels we'll visit later. We have that superior vena cava. What you see here, the two brachiocephalic veins coming together to form that. And you can even see on the side the pulmonary veins, which are bringing back oxygenated blood to the heart. So now you're getting to see the big heart in all of her open glory. So over here what we see is our superior and inferior vena cava are feeding into the right atrium. And this is that auricle that was covering it. And then this right here is our right ventricle. What we see is the right AV valve, the chordae tendineae, the papillary muscles that are attached to the chordae tendineae, that trabeculae carnae, which is the ridges inside of the ventricles, and then that pulmonary valve, which is the right semilunar valve. On this side, we can see the left atrium, we can see the left AV valve, and then the left chordae tendineae, some papillary muscles again, and some trabeculae carnae. If we look deep inside of there, we can also see the aortic semilunar valve. Hello and welcome to the video of the little heart. So we need to establish some basics first. The point of the heart is called the apex, and the top is called the base. The base is where we would find some of our major large vessels. And some of those major large vessels include the pulmonary trunk that splits into the pulmonary arteries, our aorta, and then our superior vena cava. And then we also have some pulmonary arteries peeking out on the side here, but we'll visit those when we get to the posterior. Some other key structures that you can see includes the left auricle, which is over the left atrium, and then the right auricle, which is over the right atrium. And then we can see some major coronary vessels, and that includes our right coronary artery, which will branch into the marginal artery on the margin of the heart. And then our left coronary artery, which will branch into the left anterior interventricular artery, or just the anterior interventricular artery. And then also the circumflex artery, which flexes around the heart. Paired with this anterior interventricular artery is the great cardiac vein that you can see right here. And both of these are located in the anterior interventricular sulcus, which is like a groove filled with fat and other great things. We also have that for our coronary arteries, but it's more applicable once we get to the posterior side. So now we're going to visit the posterior side of the heart, and I actually have included a rogue heart that I've taken off its base because I think this will be a little bit better for visualization. So remember that we're coming around the left side. Here's our circumflex artery, and we're coming around, and it's going to wrap down, and it's going to end in this little guy. On the right side though, remember we had that right coronary artery that branched into the right marginal artery, but it actually kept going around the posterior side to form the posterior interventricular artery. And paired with the posterior interventricular artery is the middle cardiac vein. So our great cardiac vein is up front in the show. Our middle cardiac vein's in the back because it's just the middle. And actually up here is called the small cardiac vein. So it is really hidden in this show. And then another major structure is the coronary sinus. And so this is where all those veins will feed into, and then that coronary sinus will actually feed directly into the right atrium. And that coronary sinus lays within the coronary sulcus. And there's another sulcus, the posterior interventricular sulcus. And you can see another view of the coronary sinus right here. Again, it's very neat how it actually empties directly into the right atrium. And then we see some of those large vessels again. So here we have the superior vena cava. There's the inferior vena cava. We have our aorta, and then we have our left and right pulmonary arteries and our left and right pulmonary veins. There are 2 veins for 1 artery, although it looks like 2, so just pretend that you see 1. And remember, pulmonary arteries and veins do not follow the normal rule of red and blue, so while this is indeed an artery, it is blue, and these red things are veins. So this video is a top-down view of the little heart, so we're looking directly onto that base. Again, we have that pulmonary trunk leading into our pulmonary arteries, which will then go to the lungs. We have our pulmonary veins where that nice oxygenated blood has come back to us and will empty into the left atrium. It'll then exit through the left ventricle and through the aorta, the largest vessel in our body. And then on this side, we have our superior vena cava, which is where all that deoxygenated blood comes back to the heart to go back to the lungs and get that good oxygen again. And this right here is an open view of the little heart. So what we see again is we have that superior and inferior vena cava will feed into the right atrium. It'll then travel through the right AV valve. It'll pass by the chordae tendineae. Chordae tendineae are attached to papillary muscles. And then all these ridges that you can see inside are called our trabeculae carnae. And at this point, we're in the ventricle. So this is the atrium. We pass that AV valve, and we're now in the ventricle. Then blood travels out through the pulmonary semilunar valve and through the pulmonary trunk. It goes to the lungs, we come back, and now we're coming back through the pulmonary veins, and they're emptying into the left atrium. Again, we see the left AV valve, and then we have some chordae tendineae, we have some papillary muscles, we have some trabeculae carnae, and then remember this is our ventricle, so atrium, AV valve, ventricle. Blood then leaves the ventricle and goes out through the aortic valve, through the aorta to the rest of our body. Yay! So this is a sheep heart. It is significantly smaller than a human heart. So let's just orient ourselves to major features. So this is the anterior side of the heart. We see our apex right here. We have our base up here containing those major vessels. And then we have our left auricle and our right auricle right there. So again, we're looking at the anterior side, and now we're going to open up that sheep heart and look at some major structures that you can see on the inside. So the first thing is to point out the left versus the right. This is the left side, and this is the right side. The left side will always catch your eye. Your eye will always go to where there's more going on, and that's always the left side. Remember, the left side is much larger, and it also has a much thicker myocardium than the right side does, with a significantly small myocardium. So some major structures that you can see is that we have the atrium up here. Again, we see that auricle, which tells us we're near the atrium. So our atrium is all the way up here. Then we have our left AV valve right here, this flap-like structure. Then we have the chordae tendineae. Then we have the papillary muscle. We can see some ridges which make up the trabeculae carnae, and we are officially in the left ventricle. And then it'll actually exit out, and so right here is the aortic valve. And then for the right side, we can see the atrium. We can see that flap-like valve. We can see our chordae tendineae, our papillary muscles, our right ventricle, and then we cannot see the pulmonary valve as it is deep behind there. So now we're going to look at some human hearts, some cadaver hearts. This is what we would see in a relatively normal sized heart. And let's point out some structures to orient you. We have our right auricle, our superior vena cava, our aorta, and our pulmonary trunk. Another heart we'll be looking at is this one over here. We're going to look at its insides, but I wanted to show you the comparison of the sizes. This is an abnormally large heart, as you can tell when I overlay them. So I do want to point that out. When we get to the video on this heart, it is huge. It's not what it normally would be like. Again, what we see here is this right auricle, which is over the right atrium. We see our superior vena cava. We see our aorta and our pulmonary trunk. So if you look at this from the top down, we can actually see these big vessels and they're opening. So we have our aorta again. We have that superior vena cava, and you can actually see out the inferior vena cava. We've got that pulmonary trunk, which leads to our pulmonary arteries, which I'm running this probe through. And below that, you would see pulmonary veins. Remember, pulmonary veins is what would bring blood back to the heart, versus pulmonary arteries is taking blood from the heart. So now we're back to that gigantic human heart. This is the anterior view, so we have that apex right here, and we have the base up here. But what we care about is on the inside. So what you see is a lot. So let's orient ourselves to the different ventricles. First, this is the interventricular septum, so it's going to be separating our left ventricle from our right ventricle. And up here is our right atrium. And a little cheat is that you can actually see these pacemaker leads, and pacemaker leads almost always go into the right side. So the fact that we see it running through these two chambers tells us this is the right atrium and this is the right ventricle. The other little cheat is that the left ventricle is always much, much larger than the right ventricle. You can see a massive size difference in this versus this. And then this is an extension of the left ventricle. So some of those major structures of importance is that we have our left AV valve right here. We cannot see our left atrium, but we can see the AV valve. We have our chordae tendineae. Then we have our papillary muscle. And then all of this interconnected matrix in here is our trabeculae carnae. And then this again is our ventricle. So up here, this makes up our aortic valve. So these are our semilunar leaflets that you can see right there. And then if we go over to the right side, we can see that right atrium. We can see the auricle actually right here. That's what these ridges are. The right AV valve has been perfectly cut through, so you can see one side of it right here, and then you can see the right ventricle right there. And we cannot see the pulmonary valve in here. It is in a different spot, but just to revisit just all those major structures one more time, we have our right atrium, our right AV valve, our right ventricle, our left ventricle, our left AV valve, chordae tendineae, papillary muscle, trabeculae carnae, the aortic valve, and that's it.